Good morning, sir. I am Majestic Mapute, a second-year medical student. May I know your name and your birthday, please?
Good morning, Doc. I am Neil Joy Macabulos. I was born on April 25, 1994.
So, Mr. Neil, today I'm gonna examine your abdomen, and this whole process may take for about 10 minutes. Would that be okay with you?
Okay, Doc.
And also, I want to let you know that this examination would let you undress to expose your abdomen. Would that be okay with you?
Okay, Doc.
I would like to remind you that the examination also would include examining your liver, your kidney, and your urinary bladder.
Okay, Doc.
Do you feel any pain in your abdomen?
No, Doc.
Do you have any questions?
No, Doc.
In the last 5 minutes, were you able to urinate?
Yes, Doc.
Okay, good. First thing first, patients should have an empty bladder and pay special attention, especially when draping the patient. So the sheet or the drape should be at the level of the symphysis pubis, enough to see the growing. Now, let's start with inspection. So the skin color is normal with no erythema or jaundice, no scars, no striae, no dilated veins, and no rashes or any bruises. So the umbilicus is not bulging, the abdomen is flat, and is symmetric. Since our patient is thin, peristalsis is visible, and aortic pulsation is also visible near the epigastrium. Next is auscultation. In assessing the abdomen, consider auscultation first before percussion and palpation because this may alter the characteristic of bowel sounds. Now, I'll auscultate ani brui, which can be found in the aorta, iliac arteries, and femoral arteries. To detect friction rubs, let's auscultate the liver and the spleen. Normal sounds consist of clicks and gurgles at an estimated 5 to 24 minutes frequency. To listen any bowel sounds, right lower quadrant will be sufficient. Now, let's do percussion. First, I'll percuss the 4 quadrants to determine the distribution of tympani and dullness. So, tympani predominates in the GI tract because of gas. But dullness from fluid and feces are also common. So, dullness is usually found in the liver, and tympani overlies the gastric air bowel and the splenic flexure of the colon. And for the last, let's do palpation. In palpation, let's begin with light palpation to detect any abdominal tenderness, muscular resistance, and masses, and of course, to relax the patient. Now, sir, please breathe.
Breathe. Just breathe. Just breathe.
Now, please breathe with your mouth open. Second is the deep palpation. Deep palpation required to indicate the liver edge, the kidney, and the abdominal masses. Now, let's measure the liver span of our patient. First, we need to know the lower border of dullness in our patient's liver. And second, the upper border of liver dullness starting at the nipple line. So the liver span is 7 cm in the right midclavicular line. Now let's locate the liver edge. I'll put my hand on the 11th and 12th rib on my patient's back and my right hand on the lower border of liver dullness. Just relax on my hand, sir. And press gently in and up. Can you please breathe?
Same. Can you please breathe? Same.
Now let's do the hooking technique. When doing hooking technique, it is best if we stand at the right side of our patient and put our hands on the lower border of liver dullness of our patient. Press in with your finger and up toward the costal margin and let the patient take a deep breath. Please take a deep breath. Now let's palpate for the dome of the urinary bladder. Normally, the bladder is not palpable unless it is distended. Now let's palpate for the kidney. Please move at your left side. Now I'll put my right hand on the 12th rib and my left hand on the left upper quadrant. Can you please take a deep breath, sir? Can you play space at your right side? To percuss tenderness of the kidney, place your left hand on the costovertebral angle and strike it with your ulnar surface. Now let's assess for possible appendicitis by first indicating the Mapute point. Mapute point is located 2 inches from the anterior superior iliac spine and from the process to the umbilicus. And second, let's palpate for the Robsing sign by palpating the left lower quadrant. Is there any pain you felt?
No.
Is there any pain?
No.
Now let's do the psoas sign. Do you feel any pain there?
No.
Can you please move at your left side? Do you feel any pain?
No.
Okay. Now, let's do the obturator sign. You feel any pain?
No.
Now, let's do the Murphy sign. Can you please take a deep breath, sir? Inhale. Exhale. Inhale. Exhale. So that ends our examination. Thank you so much.
Welcome daw.
So here is the findings of our patient. The abdomen is flat with normal clicks and gurgle sounds. It is soft and non-tender. No palpable mass or hepatosplenomegaly. No bruit nor friction sound heard. Liver span is 7 cm in the right midclavicular line. Liver edge is palpable, soft and sharp to touch. On inspiration, liver edge is 3 cm in the right midclavicular line on the costal margin. Bladder is not palpable and dull to percussion. Right kidney is more palpable than the left. No possible appendicitis and no acute cholecystitis when assessed with Murphy sign.